By the end of this module, you shall be able to know about the nature of polymer industry and drug industry, learn about the polymer use and pharmaceutical drugs, identify the problems due to the polymer and drug industry and its health hazards, evaluate the solutions or prevention techniques so as to protect the environment. Polymer industry. Polymer is a macromolecule formed by the coupling of large number of the monomer units in repetition. The physical structure of the world in which we live is made up of polymers. There are basically two forms of polymers, that is the natural and synthetic polymers. Natural polymers are the component of biological systems like proteins, for example wool, silk, carbohydrates such as starch, cellulose, cotton, lipids and nucleic acids that contain DNA and RNA. On the other hand, synthetic polymers like plastics are man-made and are manufactured in polymer industry. Polymers are not easily biodegraded in the environment due to its water-repelling characteristic. Therefore, they have long lifespan. Drug industry. Drug industry is also called as pharmaceutical industries. Many pharmaceutical industries are involved in manufacturing of drug substances and also have the tendency to frequently throw new drugs into the market. They develop or produce markets drugs that are registered for medication use. They have many rules and regulation considering the patenting, testing and ensuring safety of drugs. Environmental issues. Environmental implementation of polymer. The polymer industry is linked with the environmental problems regarding manufacturing, use and synthetic polymers disposal. Now we'll see how it causes the air pollution. The non-biodegradable nature of synthetic polymers makes them a permanent waste. The used polymeric products like plastic bags and bottles cannot be dumped in sanitary landfills. These synthetic waste items are then combusted in the incinerators, which results in release of harmful gases and cause air pollution. The gases that are produced during combustion include carbon dioxide, nitrogen oxide and carbon monoxide. All these gases are toxic in nature and are cause of global warming and formation of acid rain. In addition, incineration also releases dust particles. Combustion of plastics like polyvinyl chloride yields HCl gas as it contains chlorine. In moisture availability, it is converted into HCl acid, which results in the corrosion of nearby buildings and structures. It also affects the growth of vegetables in the surrounding areas. Now we'll see the water pollution. When the polymeric waste are introduced to marine environment, they are rapidly broken down into smaller particulates. These tiny plastic particles are ingested by the sea organism and results in the intestinal blockage in larva fishes. These are not only toxic for sea organism but tend to bioaccumulate in the food chain. Occupational hazards. The workers doing job in polymer and plastic industries are known to suffer from a large number of health problems. It is estimated that workers employed in polyvinyl chloride industries are revealed to severe health hazards as its monomer causes rare type of liver cancer. Therefore, a limit is assigned for the vinyl chloride exposure in industries, that is 1 ppm over an 8-hour period. Drug pollution. Drug pollution is caused by pharmaceutical drugs and their metabolites. It mainly harms the water life system. When untreated, wastewater from these drug industries reach to aquatic environment like groundwater, rivers, lakes and oceans. The chemicals from drug industry are widely used by humans and for production of food. Therefore, when it enters the environment, the drug chemical enters in their life cycle and affects health of human and other living organisms. The increase in population results in the more consumption of medicines and medical treatments, and the volume of pharmaceutical industry waste is expected to increase rapidly. These pharmaceutical drugs can come in contact with the environment mainly in three forms. They are excreted by humans and animals mainly through the urine and moves into the environment directly or indirectly by the sewage plant. Second, unused drugs reach the environment either through household water or through urban solid garbage handling. Third, manufacturing plants that are producing the active substance which can dispose of the pharmaceuticals into the environment. Now we'll see how marine life gets polluted. Most of the pollution is caused by expired drugs which are flushed down. The magnitude of flushed drug is greater in hospitals than the residential context. Because of high solubility of these drugs, they especially affect aquatic organisms and therefore most prominently water contamination is caused by drug industry. The concentration of a man-made hormone, that is estradiol and estrogen, is lower than 1 nanometer in 1 liter of water and is responsible for the production of fishes and change in their sex organs. But when the pharmaceuticals are added to the water bodies, the estrogenic compounds concentration increases and affect reproductive fitness of living organism. Other example of environment effects on aquatic environment is exposed of cardiovascular medicines. It causes a rapid decrease eggs production in fish and it lowers the blood level of testosterone in fish. Also, in the drug residue found from Dallas drinking water in US, it is estimated that the large drug producers have legally thrown 271 million pounds of pharmaceuticals into waterways. The pharmaceutical include antibiotics, anticonvulsants, mood stabilizer and sex hormones. In homes, during the use of septic tanks, the drugs removed the toilet can come into the ground and seep into groundwater. In cities and towns where residents are linked by the wastewater treatment plant, the drug flowed down the sink can pass by the treatment system and enter into rivers and lakes. They may discharge downstream to serve as community sources drinking water supplies and pollute the drinking water as water treatment plants are generally not equipped to remove routine medicines. Health hazards to humans. Health hazards due to polymers. The additives used for hardening of plastic, that is plasticizers, mainly causes health hazards in humans. For example, phthalate esters, plasticizers are taken out by the blood from the plastic bags which are used for storage of blood. It enters in the bloodstream of patient when he receives that blood. The health problems concerned with polychlorinated biphenyl are more dangerous. They are fat-soluble polymers and therefore They concentrate in the aquatic organisms. When humans consume contaminated fish, they are bear to headache, fatigue and pains in joint. If the polychlorinated biphenyl concentration increases to 12 ppm, it results in blindness. Impact of pharmaceuticals on human health. The effects of pharmaceutical drugs on human health is influenced by many factors. These factors include drug concentration, type of drug, and its distribution in the environment. Few environmental pharmaceutical chemicals are well known which causes serious hemotoxic effects in humans. The pharmaceutical drugs may react by chance when mixed with the different chemicals from the environment in the food chain. Some of the drugs are very active even at very low concentration. It is found that the development of growth of frogs in aquatic environment is affected by an antidepressant class. The chemical in these products can either harm the feminization or masculinization of different fishes. Therefore, their reproductive rates has large impact. Also, the consumption of contaminated water affects the lives of consumer. These are also found in soil as these chemicals cannot be degraded easily by biological process or take a long time to degrade, so they can insert into the food chain. Some known pharmaceutical drugs and their impacts on human health are as the first we will take up as penicillin. Penicillin is highly allergic in nature. Its extensive use causes allergic problems. The most serious reaction of it is shock. It occurs in minutes after shown by penicillin. Symptoms are tightness in the chest, asthmatic breathing, lip swelling, tongue or face, and even heart failure in some cases. If workers exposed to tetracycline and streptomycin, the bacteria modification led to a drop in the body's vitamin content, especially of vitamin B. Another problem associated with the occupational shown to tetracycline is drug resistance. Workers may develop infections that are resistant to treatment with tetracycline. Next are antibiotics. Antibiotics are the chemical substances capable of destroying microorganisms such as bacteria and viruses, which cause infection in animals and humans. The occupational exposure effects of antibiotics include: first, allergic reactions, itching and eye redness, runny nose, skin rashes, asthma, and occasionally shock due to an allergic reaction called anaphylaxis. Next, vitamin deficiency. Workers with regular risk to antibiotics experience a change in bacteria type and number, which are generally available in the intestines that break down and absorb vitamins in the intestines. Next, fungal infection. Daily risk of antibiotic dust may cause fungal infection of the skin and nails. Additionally, women workers may develop vaginal yeast infections on exposure to antibiotics. Toxic effects. Exposure to certain antibiotics may lead to development of some of the toxic side effects that occur when that drug is given as medicine. Next, we'll take up the nitroglycerin. It is commonly used in dynamite. It is a medicine for heart patients. Its exposure causes headache due to relaxation of blood vessels or down in blood pressure. It results in dizziness and even fainting may occur. Other more serious effects are heart pain, heart attack and sudden death. Then we'll see how they affect the reproductive systems. The study of women found an increase in spontaneous abortion increasing with exposure to methylene chloride, benzene, estrogens and toluene. 12 of 24 female production workers had intermenstrual bleeding. Exposure to solvent and methylene chloride in particular may have harmful effects on pregnancy. Now we'll see how to prevent and control it. Prevention for reducing polymeric pollution. To reduce the pollution of health hazards caused by the synthetic polymers, it should be biodegradable. It is possible to recycle the used plastic items, thus reduce the pollution load. There are two methods for reducing environmental problems caused by polymeric pollution. First, the photodegradation process. It is the process of breaking down of macromolecules into smaller units by sunlight. It is done so that micromolecules can be easily metabolized by microorganisms. Exposure to ultraviolet radiation may cause significant degradation of many materials. Almost all the synthetic polymers need stability against the hazardous environmental effects. It is important for industry to find a solution to reduce or prevent damage caused by environmental components such as heat, light or oxygen. Recycling of plastic. Another way to decrease the polymer pollution is to recycle the used waste plastic items. It is taking place in number of steps. Firstly, the non-plastic material is separated manually, then the plastics are granulated and washed so as to remove dust and paper labels. The granule material is then moved through a series of hydraulic tanks to remove heavy particles such as stones and metals. Then the clean granules are finally molded to final product. Good manufacturing practice in drug industry. The good manufacturing practice is a system which is important to be adapted in manufacturing of pharmaceutical drugs. The practice includes quality control, quality system and testing of pharmaceuticals. Now and then, threshold limits are recommended for pharmaceutical products by the research workers. The almost complete absence of official data indicates that it is mandatory to reduce exposure to the least possible level. Few researchers have concluded that it is difficult to evaluate causes of morbidity in pharmaceutical workers because manufacturing processes and additives differ between factories and exposures are to multiple chemicals. Unwanted and expired prescription should be returned and over to a drug take back program. For household disposal of drugs, steps should be done. First, prescription drugs is taken out by their original containers. Second, the drugs are mixed with an undesirable substance such as cat litter or used coffee grounds. Third, mixture is thrown into a disposable container having lid such as an empty margarine tub or into a sealable bag. Fourth, conceal or remove personal information consisting of prescription number on the empty containers by covering it with the permanent marker or duct tape or by scratching it off. Fifth, the sealed containers having drug mixture and the empty drug containers can be placed in the trash. The other preventions that should be taken especially by the workers are the respirator use with a high efficiency filter, and all the respirators must be checked to make sure that they are fit well enough for protection. Gloves should be wearing by workers to protect their skin from contact with chemicals in the drug industries. Now let us summarize. In polymer industry, manufacturing of the synthetic polymers takes place, and drug industry is known to make pharmaceutical drugs that are used in medication. The non-biodegradable nature of synthetic polymers makes them a permanent waste. Also, the chemicals from the drug industries are widely used by humans and for the production of food. Therefore, it may enter in the environment during its life cycle and affect the environment and human health. The increase in population results in the more consumption of medicines and medical treatments, and the number of pharmaceutical and plastic products are expected to increase rapidly. To decrease the pollution of health hazards caused by synthetic polymer, it must be biodegradable also. The unwanted and expired prescription should be returned and over to a drug take-back program.